Shin splints. What are shin splints? Shin splints is a very common ailment that affects athletes but can also occur in the non-athletic individual. It is an inflammatory condition occurring either in the front of the lower leg or in the back. The cause for each is different. Typically, with this type of symptom, a person will be doing some kind of athletic endeavor, walking a long distance would qualify, and begin to notice a soreness in the lower leg, either in the front or back of the leg. The more the person moves, the more the condition worsens. Should the person stop, the pain will diminish somewhat, only to worsen once the activity is resumed. Types of shin splints. Anterior shin splints, or pain in the front of the lower leg, may be more prevalent running on hard surfaces, or running or walking downhill. After the heel hits the ground, in gait, the foot should slow down in order for the front of the foot to hit the ground. People with a tight heel cord, Achilles tendon, do not allow the foot to slow down, so the muscles that control the forefoot and originate in the front of the lower leg are forced to overwork. This overworking of the muscle causes the muscle to swell, and since the muscle is in a confined location in the lower leg, the swelling causes pain. Posterior shin splints generally occur in people who are moderately to severely pronated, or more commonly known as flat-footed. People who exhibit this type of foot structure force their feet to overwork, thus causing the muscles in the back of the lower leg to also overwork. Again, this overworking causes the muscle to swell, and since it too is in a confined space, pain will occur. Treatment of shin splints. Symptomatic treatment of the condition is through the use of icing the area and taking anti-inflammatory medication such as aspirin, Aleve, Motrin, Advil, etc. Also, avoiding the type of walking surface that caused the problem would be indicated. This is acceptable treatment for the short term, but not considered a solution to the problem. Permanent solution is to have your feet examined by a foot specialist to determine the type of foot structure you exhibit and thus find the cause of the problem. Generally, an orthotic, usually a prescription type of device will be indicated, but certain individuals may also experience relief with an over-the-counter type device. The purpose of the orthotic is to either reduce pronation in those with posterior leg pain or to reduce the strain on the Achilles tendon in those suffering from anterior leg pain. In addition to an orthotic, the athletic individual should also examine his athletic shoes, as there are various types of shoes on the market, many of which may help correct the abnormality in the foot structure and thus relieve the symptoms. A good athletic shoe that is worn out will also cause this problem. The non-athlete should also examine his or her shoes, as flimsy type shoes may exacerbate the abnormality in that person's foot structure and bring about the pain associated with shin splints. Conditions that mimic shin splints. Other conditions that may mimic this condition include stress fractures of the lower leg, along with muscle tears. Periostitis, which is an inflammation of the periosteal tissue that surrounds bone, may also mimic shin splints. This condition tends to be more chronic and will not respond to biomechanical changes applied to the foot. Lastly, a condition that mimics shin splints but has the potential for more serious consequences is known as anterior compartment syndrome. It is basically a more severe form of anterior shin splints. However, in this case the excessive swelling of the muscle will cause excessive pressure on the nerves, resulting in numbness in the area and weakening of the muscles into the foot. This is considered a medical emergency and immediate medical care is indicated. Read the complete article at www.fot-pain-explained.com/shin_splints.html